started the timer and here is your question. Right, if you have read and understood, kindly begin your history-taking session.
Yes. Good afternoon.
Hello, good afternoon.
My name is Zaid. I'm one of the surgical doctor here. Could I confirm your name and date of birth, please?
Yes, hi, my name is John. I'm 50 years old.
Nice to meet you, John. How I can help you?
Doctor, basically, I've been having some breathlessness basically for the past 4 weeks. And it's been getting worse since the past 4 weeks. And now I'm having some discomfort in my chest. I've just come for that mainly.
I'm sorry to hear that. You said you have this symptom for 2 weeks ago.
No, 4 weeks, 4 weeks.
4 weeks.
Yes.
Before 4 weeks, you are fit and well.
Yes, yeah, it's been almost a month. Before that, I was fine, yeah.
Okay, could you explain for me how did this start?
Around about 4 weeks ago, when I was walking my dog out, I noticed that I'm having some breathlessness, and then it sort of settled. But then lately, I've noticed that it has been increasing in its frequency. I've noticed it more and more throughout the day.
Okay, all time there, or just you have this symptom when you are walking?
So, sorry?
The symptom all time there, or you have this symptom only when you are walking?
No. Now it's present. Even now, when I'm actually at rest, I'm having discomfort. I'm having breathlessness. I'm having some chest discomfort.
Okay, have you had any pain?
Intermittently, but not all the time.
Okay, anything that can make this breathlessness is increased?
Nothing that particularly I have noticed. No.
Anything that make it better?
No, nothing I've noticed it getting better. No.
Is there any cough?
No, I'm not having any cough. No.
Okay, is this symptom is worse when you are lay down, or when you are sleeping, you put more pillow beside your head?
No. I've not noticed anything like that. No.
Okay, if there is any skin rashes?
No, I don't have any skin rashes. No, doctor.
Any swelling of your legs?
No, I've not noticed any swelling of my legs.
Okay, do you feel your heart rate more raising than normal?
No.
Okay, have you had any other disease, other condition?
Yes, doctor. I've had I think it's a pulmonary embolism, and I'm taking a medication. I had it around 5 months ago. I'm taking I think it's called a blood thinner. Since the past 5 months, I think it's
Okay, now you are on platinum medication. Anything else
yeah.
besides this? Any other medication?
No, just this mainly.
Did you miss any dose of this platinum medication, or you neglect to
No,
take
I've
it?
been taking them regularly in the evening.
Okay, have you had any surgery before?
No, I have not had any surgeries in the past. No.
Okay, I want to ask you some personal question, if you don't mind.
No,
Did you
please.
smoke?
Yes, I do smoke.
How many cigarettes per day?
Around about 4 to 5 cigarettes per day. the past over 30 years.
Do you drink?
Occasionally, the beer once in a while, the weekends.
Who live with you at home?
I'm live with my wife and a couple of dogs.
Okay, I need now to ask you some question related other system. Have you had any change of your bowel habit or tummy pain?
No,
Any headache or blurred of your vision?
no.
Any problem with your water work or
No,
open your bowel?
no.
Any numbness or weakness of your arms?
No.
Have you had any idea what may be the cause?
I'm not sure, but I don't know if it's actually something that happened similar to the one that happened 5 months ago. So I'm just that's what's concerning me.
You mean pulmonary embolism?
But yes. I'm not sure if that's it. If it's something to do with that.
Anything particular you are worried about?
Like I said, I'm concerned that it's again it's a relapse of the PE, the pulmonary embolism. So I'm worried about that.
Okay, have you had any family history have the same problem?
No,
Any history of cancer running your family?
no.
Okay, okay, thank you, Mr. John.
Thank you so much.
Thank you.
You still had 20 seconds. Okay.
Okay, I think I finished it. Okay.
You can present then. Okay.
Okay, I took a say from Mr. John, 50-year-old. He have a breathlessness for past 4 weeks, suddenly an onset progressive and not related to the diurnal or to the position. Is nothing to relieve the symptom not associated with cough or pain, and have previous attack of pulmonary embolism 5 months ago. He is on warfarin treatment regular. Uh, he didn't have any previous surgery or family history of similar condition.
So what are
think
your differential diagnosis?
Yes, I think most of my top differential diagnosis could be second pulmonary embolism, second attack. It's going to be chest infection.
Okay.
Yeah, it could be cardiac problem like ischemic heart disease.
Yes.
Yeah.
How do you plan to manage this patient further?
I will examine the patient fully. I will send for the patient chest X-ray, ECG, cardiac enzyme, and I will set for him CT pulmonary angiogram. Also,
Yes.
I will check for the bleeding coagulation status.
Anything else?
Echocardiograph,
Okay. And
CKMP, and troponin, chest
VQ
X-ray.
scan. Okay. How do you
And
plan to manage this patient, or what treatment options can you offer?
I think a patient now in pain dyspneic, I will deal with this like CRISP protocol. I will stabilize the patient, and I will, if the patient have pulmonary embolism,
Yes.
I'll treat the patient according to, if it is a small, I can give him anticoagulant or antithrombotic medication, heparin. And if he
Yes.
is severe and unstable, I will prepare patient for cardiothoracic surgery for embolectomy or thrombolysis.
Okay. How would you differentiate in non-massive and massive hemolysis or
If
thrombolysis?
patient stable and just have chest pain, that's suspected small emboli. If
Yes.
patient unstable, even with resuscitation, suspected the main pulmonary is obstruction and it is a big emboli.
Okay. Thank you. Yes.
Thank you.
Dr. Sidat, can you please give feedback first?
I think he did well. The only thing is he could have actually pinned down on the history of chest pain a little bit more. I did say that I have intermittent episodes of chest pain.
Yes.
They could have asked for the sites, onset, character, radiation, the whole history
Yes.
about that.
And orthopnea, nocturnal.
No, he asked about okay, he
He
didn't
did.
ask specifically. Yes.
Did he ask
He said
about
he asked for
cuff?
Yeah, I
he
asked
asked
about.
about cough.
Okay, I'm
Yes, he
sorry,
asked
I
about
missed.
orthopnea. He didn't mention paroxysmal nocturnal dystonia. He said, I mean, you have to ask if you get up from sleep for catching your breath.
Yeah.
Yeah.
But he did mention orthopnea. Yes.
Exaggerating and relieving factors and pain between 1 to 10.
Yeah.
Yeah, that you could have asked. What makes it worse? What relieves it?
He asked for leg pain, Abhishek.
Yeah, leg
So
pain he did.
he asked for that.
Okay, good. More or less, those 20 seconds that you saved, you could have covered this in that.
Yeah.
So
If
you'll add this. Yes.
if I analyze the the pain, I think I will be in that.
Yeah. Pain
yeah.
scale and yes, nocturnal. Paroxysmal nocturnal. This now you can ask next time. Good. Okay. Yeah, coughing. Okay, good. Thank you. Started the timer and here is your question. Right. If you have read and understood, kindly begin your history taking station now, please.
Yes, ma'am. I'll go in. I'll wash my hands.
Yes.
Hi, my name is Dr. Sridhar Murli. I'm one of the junior surgical doctors here today. Can I confirm your name and date, name and age, please?
I'm Steven, 57 years old.
I'm sorry, I can't hear you.
Can you bring
Steven,
mic closer?
Sorry, what's your
hold on.
Steven, 57 years old.
Steven? Is that?
Steven, yes, 57 years old.
Hello, Mr. Steven. Good to meet you. Can you tell me what brings you to us today?
Yeah, doctor. You know, I've been having this swelling. I mean, lump. You know, just at my left groin, and it's
Okay.
really, it's very painful. So, and I've had it for about 3 months now, but it's getting worse.
Right. I'm so sorry to hear that. So you said that you're having the swelling since the past 3 months, and has it been painful since the past 3 months, or is it something that is new?
Yes, it's really painful. So at first it was more, like a subtle pain. However,
Okay.
now the pain is really, it's really much and it's becoming
Okay.
unbearable.
How
Yeah.
long has since the pain has gotten worse? Since how long has it been like that? Can you please tell me?
I think, initially I barely noticed the pain, but these days I can't even do anything without feeling the pain. It's really
Okay.
affecting me.
I'm sorry to hear that. Are you having pain exactly at the site where you're having the swelling? Is it
Yes,
just in the left groin you're having the pain?
yes.
Okay. And what type of pain would you describe it as? Is it like an aching pain or a burning pain or a muscular
It's
pain?
like more of like, it's giving me this kind of pulse that like I can feel it, like it swell at interval, you know.
So you're getting like a pain which is coming and going kind of a pain? Is it like a
No, like it's like a pulse, I can feel it.
pulse? Okay.
Yeah,
All
it
right.
follows like pulse, something like that. Yeah.
And do you feel that the pain is actually going down your leg or back to your back or anything as such? Do you feel the pain radiating anywhere else?
No. Only when I'm trying, if I try to move my left leg, maybe stand or something, then I can feel the pain.
Okay. Can I ask, how did the swelling begin? Did you have any trauma, or do you recall any incidents that led to this swelling developing?
Yes, I think I had a few months back. I have some procedure, so whereby they, they did. Doctor, they tried to do something like assess my vein, something through that area, I think. So
So you had a procedure in that site, is it? And that's following that you're having
that,
swelling?
that's not immediately, but shortly after that, I started noticing the swelling. But I thought nothing of it initially. So
Right. Okay. So sorry to hear that. Have you noticed any other symptoms along with that? I'm going to ask. Do you have any fever at all?
yes. I've been having this fever, like in the evening most of the time. So
Oh,
not so
okay.
much.
Sorry to hear that. What about any discharge or any blood discharge, blood or any pus discharge from that site? Do you notice anything over there on this over the swelling?
Not none. But
No.
another thing is the side sometimes gets a bit red.
The what? Sorry.
On the side,
Little red. Is that what you're saying?
yes, reddish, yeah, reddish brown. Yeah.
Oh, sorry to hear that, sir. What about? I mean, so you're saying it's on the left side. What about? Are you having any pain in your left leg? Are you having any difficulty? I mean, I can understand with the pain, it'll be difficult to move the leg. But are you having any weakness or anything on your left leg as
Not at all.
compared to right?
Not at all.
No. Are you having? Have you noticed any suddenly any loss of consciousness or anything like that? Have you noticed anything as such at
Not
all?
at all.
No. Okay, that's good. I have to ask this. Have you had any? I mean, I understand about the surgical procedure that you've had, but other than that, have you been injecting or any? Have you had any injections over that site or anything like that?
No.
Okay. And on a scale of 1 to 10, with 10 being the worst kind of pain that you can imagine, how much would you rate this pain as?
You mean at the moment? So
Yes.
I will rate the pain to be 6 or 7.
Okay. And then you said at the moment. So have you had any changes in the severity of your pain before?
Yes, initially, like I said earlier, it was subtle, but now it's really troubling.
Getting back. Okay, so I'm so sorry to hear that. I'm going to ask you a little bit more of your background history. So you said that you had this procedure done about how many months ago did you have the procedure, sir? And can you
Then
tell me a little bit more about that?
just around that 3 months ago. So
Okay. Did you had a procedure for? Can you explain a little bit more about that?
the thing is, so they said I have they have to put something, into my vein. So like they call it
Okay.
a vascular intervention or something like that. So I really don't know much. So
Okay.
the
All right.
doctors they use that site. So that was when I was.
Are you on any medication for any illness that you on any medications currently?
Not at the moment.
Okay. And are you allergic to any medications at all, sir?
Not at the moment.
No. So you're not on any medication. So is there any similar issue like this in your family with any problem with the vessels or anything as such in your family? Do you recall?
No. No.
I'm going to ask a little bit more about your personal life now. Are you married?
Yes.
And you're living with your partner now?
Yes.
And what about your occupation? Are you currently working, sir?
Yes. I work
And
as a school teacher.
as a?
Teacher.
I work as a school teacher.
All right. And I need to ask about, do you smoke, sir?
Yeah, I do smoke like 1 pack per day.
Sorry? One
Yeah,
pack per
yeah.
day. For how many years?
For since I was a teenager. So
Okay. And what about alcohol intake? Do you take
I don't
drinks?
I don't drink.
Okay. And do you use any recreational drugs? Any drug use at all?
No.
Right. So do you have any idea as to what's happening with your leg and the swelling as such?
I think maybe the doctor they did something to me when I was operated. When they did the procedure, maybe that's
Right.
why this thing happened to me.
Okay.
Because they
Anything
did
else?
told me that the procedure something I could get something from it, like infection or something, but I'm not sure. But this doesn't look
Okay.
like infection, does it, doctor?
We'll have to run some tests, and I can confirm that for you.
Okay.
Before I complete, can I ask, is there any other concerns that you want to tell me before I go?
Like I said before, nowadays I can't even move, so I can't go to work. So
I can understand that. And what are you expecting from us today?
I just want to feel better.
Yes, sir. Thank you so much for coming in today. I'll discuss with my seniors and I'll get back to you. Is that okay?
Yeah.
Thank you so much,
very
sir.
much.
Right. Now I'd like to summarize my case. I had the pleasure of meeting Mr. Stephen. He's a 57-year-old gentleman who's had a procedure of his left, looks like a femoral artery, done 3 months ago, following which he's developed a swelling on his left lower leg, left groin, which has been gradually increasing in size to the present stage. He has also been experiencing pain over the left groin swelling, which has been progressively impairing him. He describes it as initially a 2/10, and which has gradually worsened to a 6/10 currently. This is causing him to cause problem with his daily activities and impairing his daily routine work. So, on my further history, further eliciting my history, I can understand that he's not an IV drug user. There is no previous history of any injections or on the leg. There's no other ischemic manifestations that I could think of. I could elicit, and also no other neurological manifestations that he gave me history for.
So what is
Considering
your
this history, my provisional diagnosis would be an infected pseudoaneurysm of his left superficial femoral artery.
Yes. Anything
Or abscess, or a lymph node, groin abscess, or an infected hematoma.
Lymph node or inguinal
Lymph
hernia.
node which is causing an abscess now, considering the fever.
Or strangulated. Okay, how do you plan to manage this patient?
I'd like to further investigate this patient, complete the history, and do a proper examination of the local region. I would like to further image the area with a CT angiogram to vascularity of the limb and to check the involvement of the swelling in relation to the vessels.
And then what treatment options can you offer this patient?
I'm confirming my diagnosis. I'll have to treat the diagnosis as such. If it is infected pseudoaneurysm, I'll have to go for ligation of the involved artery, followed by delayed vascularization of the limb. Otherwise, if it's just an incise and drain and send the pus for culture and sensitivity.
Okay, what is the non-operative management or treatment that you can offer this patient?
For infected pseudoaneurysm, we could try with conservative management, IV antibiotics for a long period of time, but
duplex ultrasound guided compression and percutaneous thrombin injection. Okay, can you define or can you tell me the difference between pseudoaneurysm and true aneurysm, please?
True aneurysm is when there is all three layers of the vessel involved, whereas pseudoaneurysm is usually in between the layers, usually in between the tunica media and adventitia, the blood gets collected.
Good.
And that part of the vessel is dilated.
Yes, and that can become pulsatile and resemble true aneurysm. Very good. Okay. Except for the fact maybe you didn't hear. I tried that bell will go a lot and you'll hear, but you took 2 minutes extra.
2 minutes extra? Oh God.
Yeah.
Okay. I didn't hear that at all.
Yes, when you'll hear the recording, you'll hear.
Sorry, I heard the bell. I guess it was a little bit. Then I sent the message. Actually, bell rang or not?
Bell rang, yeah.
Siddharth, you can see my message. It was.
Yes.
So it was like
when you hear the recording, you'll realize because I allowed it to go because you were continuing. So otherwise, it was excellent. It was superb. But only if you could have just speed yourself a little bit and then try to cover everything within the given time. Otherwise, it was superb. What about Dr. Sunday? If he can give you, yes, please.
I think he did well.
Yes.
So he showed empathy.
Yes.
So apart from one moment when I first talked about the pain, that he kind of skipped without showing empathy. Apart from that, the rest of the time he showed empathy.
There's network issue. I am not sure if he heard you properly because he wasn't listening.
Maybe. But the rest of the time,
when he asked you about the profession and you said I'm a teacher, you said twice he couldn't hear. So there was delay on his side or there was network issue.
Yes. So, but but I think the communication skills, because as a patient, I felt safe, communicating with him because it flowed very well, and that's for me.
That's positive. Very good. Thank you. I only have concern with those 2 extra minutes.
Genuinely, there is a problem. I couldn't hear the bell. I just have to stop there. And I would have just said to complete my history, I would have asked so and so.
Yeah.
I used to do that.
Please
but I didn't
remember
hear, I was
this.
waiting
In
for the bell.
exam, you have to do this, and we have to be vigilant when the bell goes. So
Yes,
good.
Okay.
Okay, and here is your question.
Hello. Hello.
3 seconds.
Wait.
Okay, bell has gone. If you have read and understood, kindly begin your station now.
Okay. Hello. Good evening.
Hi, good evening. Wait, please tell me.
I am Mohammed Al Ayan, one of the exam candidate. Might I confirm your name and age, please?
Hi, my name is Louis. I'm 56 years old.
Nice to meet you, Mr. Lewis. To ask you few question regarding the
Your
postal
network,
agent.
Dr.
I am
Mohammed.
here to help you. On here?
I can't hear you.
Yes, your network. I couldn't hear the question, please.
Hello?
Hello. Hello. Nice to meet you, Mr. Lewis. Today I have been asked to ask you a few questions regarding your condition, include personal question. I am here to help you. Are you okay?
Yes, please.
Okay. Can I have Shabron here?
Yes, I'm Shafron. Yes, go ahead.
Yeah.
Okay. Okay. How can I help you today?
So doctor, basically, for the past few weeks, I've noticed that I'm having difficulty with mainly my erection. Actually, I'm having problems with that. I'm not having a good sexual life. If you understand what I mean.
I am sorry to hear that. Did this start suddenly or gradually? The obtain a difficult erection?
I've noticed this over the past 1 month. I think it's gradual. Yeah.
Okay. Anything make the difficult improve?
No.
And that the difficult getting worse?
Getting what? Sorry. Getting worse? No.
Do you experience nocturnal or morning erection?
No, I don't really know.
The erection suitable for penetration?
I'm afraid no.
Can penetration maintain until the partner has achieved orgasm?
I'm not able to get an erection at all.
Does ejaculation occur?
No, doctor, no.
Do both partner experience have sexual satisfied?
I'm afraid not. I'm having problems with my wife, actually.
Do you have any benign curvature problem?
No.
Do you pain or discomfort during sexual intercourse?
I don't have any pain. No.
Have you noted any episode of feeling down?
No, not particularly, no.
Have you difficulty getting to sleep?
No, no.
Have you feel overly tired every day?
No, I'm not tired, no.
Have you noted changes in your appetite or change in your libido?
My libido is actually definitely decreased. I think it's because maybe, I don't know if it's because of this problem or not, but I've definitely, it's reduced, like I said, since the past 1 month.
I am sorry to hear that. Any problem or tension in sexual relationship or any stress can be affected for the sexual relationship?
I'm afraid this is actually causing a stress on our sexual relationship. Yes, this is the main problem.
Any anxiety related to performance?
No, I'm not anxious, no.
Are you married?
Yes.
Was your last sexual contact?
I think it was fairly at least a couple of months ago.
Do you use contraceptive?
No.
Do you have any other medical condition like diabetes mellitus, hypertension, asthma, stroke, jaundice?
No, otherwise, no, I don't have any illness such as that. I'm otherwise fit and well.
Any history of the trauma to the pelvis, any surgery, any irradiation to the prostate?
No, it's been surgeries, no.
Do you take any medication like antihypertensive, hormones, steroid, lipid-lowering agent?
No, I'm not on any medications, no.
Patient is taking atenolol for hypertension.
What's your occupation?
Sorry?
What is your occupation?
I was in the army previously,
What's
but
your
now I'm not
occupation?
working. No, I was in the army previously, but I'm not working now. No work.
Who is at the home with you?
I live with my wife and 2 children.
Who? Do you smoke?
Used to, but I gave up about a year back.
How many packets per day?
I used to smoke at least 2 packets per day for almost over 20 years now. Hello?
Dr. Mohammed?
Do you drink alcohol?
Occasionally.
Do you drink alcohol?
Occasionally.
Sometimes.
Sometimes, yeah.
Yes. Next.
Hello?
Hello, yes, I do drink occasionally.
Family have this problem?
What? Sorry, I couldn't hear that.
He got disconnected, I think.
His network is kind of bad.
Hello?
Yes, Dr.
Hello,
Mohammed.
yes, yeah.
Okay, what do you think the cause?
No, I'm not really sure. I'm concerned as to what it is.
What are you the most concerned about?
I'm concerned about this problem, obviously, and I need some cure for that.
What are you hoping us to do for you?
Like I said, I want you to find out what's wrong with me and then to basically give me the treatment if possible, please.
Do you have any breathlessness, dizziness, wheezy chest pain?
No. I
Do you
have
have any?
not noticed any other symptoms at all.
Do you have any difficult in the swallowing, change in bowel habits, any pain in your tummy?
I have not noticed any other symptoms at all, doctor.
Do you have any muscle or joint pain or deformity or swelling?
No, doctor, no.
Anything else you want to add?
No, no, doctor, no.
Okay, thank you.
Thank you so much.
Thank you. Can you present your case now, please?
Yeah, I am take history from Mr. Lewis, 56 years old, complaint of the loss of the nature from the 2 month, and the patient have smoker from the 2 month, and no history of the surgical procedure, and no history of the drug history. My professional diagnosis could be psychological erectile dysfunction, and another differential diagnosis could be phenogenic erectile dysfunction, and also uncontrolled hypertension and diabetes mellitus, and also renal failure and multiple sclerosis, and could be drugs like antihypertensive drugs and steroid and antipsychotic drugs and anabolic hormone.
Okay, good. How do you plan to investigate this patient further?
Yeah, the investigation can be done hematological full blood count and ASR and hematinic glycated hemoglobin, and also urea and electrolyte and lipid profile and CRP and liver function test, and the prostatic specific antigen and hormonal assay like serum FSH and LH and prolactin, and the urine analysis to exclude any genitourinary causes, and the duplex ultrasonography to the penis and the testis to exclude any abnormality, and to assess the vascular function of the penis, and also angiography, and also transrectal ultrasonography, and also test ASCA injection of the prostaglandin to assess the rigidity after 10 minutes.
So what are the treatment options that you can offer to this patient?
Yeah, the treatment include risk factor modification, control
Yes.
diabetes and the
Yes.
hypertension and the lipidemia, and advise the patient to stop the smoker, and regular exercise and weight loss, and start with the phosphodiesterase 5 inhibitor as sildenafil, and the intracavernosus injection of the prostaglandin, and they can be used the placement of the benign prosthesis, and can be also external vacuum device, and also sexual counseling if the no organic causes can be found.
Good. Okay. Thank you so much. Yes. Since the network was bad, you kind of took 2 minutes extra. Also, when the patient told you about his problem, instead of like, I know you, it was your gesture of saying, but then just to acknowledge that you're listening. But then if you could just say, I'm really sorry to hear this, or just show that you feel the pain of the patient, then that would be more better. Otherwise, it was good. You covered everything and you asked, yes, everything. But then I just wanted that the way patient was saying it's affecting my married life as well. And yeah, so like in that moment, you were supposed to show a lot of, once you said only once, but then it was like you could have said it repeatedly or maybe more often. Yes, Dr. Siddharth, would you want to give feedback?
No, he was really good, and I really like the fact that he asked for a chaperone in the first. I think
Yeah, this is one history station in which you have to ask for
he should ask
chaperone.
for chaperone, and this is the only history station like that. And it was
Yes,
liked it from the beginning that he asked for that, and he
yes,
asked the right questions.
yes.
It was perfect, actually.
It was perfect. It was
And it is
just,
one of those stations where you can't complete it in 6 months' time. So
no, he did manage, but 2
yeah,
minutes extra he took. Okay,
yeah.
Dr. Suman Kumar wants to know. Dr. Mohammed, can you repeat?
Hello, ma'am.
Yes, just a second. Dr. Suman Kumar wants to know the differential diagnosis one more time.
Yeah,
Yeah. Can you please repeat? My network is very poor. I cannot
If
hear.
you can maybe write, they'll all get it. Dr. Mohammed,
Yeah,
please.
yeah.
yeah.
Because if network is bad, you'll write, they at least get it.
As a side note, ma'am, in this station, I mean, I don't know where is hypertension. I don't see anything mentioned on your stem.
Oh, not in my stem, but in the actual patient.
In the
Patient
actual
will
zone,
be
it is there. The
patient
patient is
will be
on
hypertensive
antihypertensive.
and taking
Yeah.
atenolol.
Yeah, that is the reason why. Yes, that's so I was just
Yes,
confused about that.
I told you because my stem has to be different. You know, it cannot be copy paste of what others are.
No, ma'am. So I was steering the discussion according to your stem that you were
Sorry,
providing.
yes, in this
No,
one
I'm
it
just
was
saying.
not. That's why
Yeah,
he mentioned it in differential diagnosis. Dr. Mohammed,
yeah,
are
yeah.
you
He did.
writing?
Yeah, asked the differential diagnosis.
Yes, please.
Yeah, differential diagnosis could be phenogenic erectile dysfunction, could be a psychological erectile dysfunction, and another differential diagnosis could be phenogenic erectile dysfunction, and it could be uncontrolled diabetes mellitus and hypertension and Leerish disease, and could be hyperprolactinemia and hyperthyroidism and hypogonadism and renal failure and intervertebral prolapse disc.
Okay, good. Thank you. No, now Dr. Abhishek has a question, please, or comment. Yes, please.
Okay, ma'am. Regarding this station, like
yes.
mostly, ma'am, it's about something personal about the patient,
Yes.
and
Yes.
Dr. Muhammad Alan actually asked all the things, like touched all the points.
Yes.
But it would be better if we just begin like this. Like today, I'm going to ask you very personal questions, and that will be really confined to us. And don't hesitate about this questioning, because we really do this type of questionings who have this type of problem. And then we can ask about patient's opinion. Like we want to do this in front of a chaperone. Would you mind doing that? So we can start in this way, like it will be more helpful in the patient's comfort, in regarding the patient's comfort and everything. And after that, what I have to say, actually, ma'am, there are some questions that we have to ask. So in this case, Dr. Sridhar actually said, like there may be psychological depression, but he is not having, the patient is not having any kind of morning or nocturnal erection. So it is very
No.
unlikely that it's a psychological erectile dysfunction. Definitely there should be our
Underlying
first
cause.
differential
Yeah.
would be, yeah, underlying cause. And as the patient is taking antihypertensive, also a smoker, so first differential maybe there can be atherosclerotic vascular disease due to smoking, something like that. And then it can be due to antihypertensive drug the patient is using. And also you can say then that psychological depression, erectile dysfunction or impotence. But as the patient is not having any kind of morning or nocturnal erection, so then asking about this type of questions, okay, is it suitable for penetration? Is it something like both of your partners that get sexual satisfaction or not? Rather than asking this question, we can just ask about the small, like the sleep pattern, M for mood, A for appetite, and L for libido, something like that, then any anxiety and all the things. So if the patient just have any kind of erection, if they try it, then we can go with the flow, like whenever they can try. So in this patient, actually, he's not having any kind of erection. So asking the other questions regarding is it suitable for penetration or both the partners get sexual satisfaction, that can be sometimes like, ma'am, irrational, something like that.
Yeah, it can be embarrassing.
Like Dr. Sridhar was saying no to all the questions, and
yeah,
sometimes
but
the patient can get
Actually, ma'am, I would like to raise up, add a point here. The history that Dr. Abhishek is saying, I think it belongs to the depression station, where you have to ask for sleep, appetite, loss of libido.
This is not depression.
That's also
it
asked
was
in this
importance.
station.
Yeah, but that only is valid if the patient is depressed.
Yes. Here
then
patient was not depressed.
Here the
patient is not depressed, but depression is very much related to this station. So that's why you have to ask about these things.
It's like
actually.
What? Just one by one, please.
Can I just say, it's like
please.
the patient was having urinary symptoms, we can ask for lower urinary tract symptoms, all the urgency, acidity, we can run through it. So this is, I mean, I think we need to, play a better of both worlds in the sense. And if he is depressed, definitely we can ask for all those questions. That is true. But I think he took the correct this patient with erectile dysfunction. He should ask all those questions, even if the patient is not having.
Yes, I agree
even if
with you.
Not having an erection, he should ask for.
He should even then, because sometimes like on his part it's fine, but on the other part it's the other person, the partner is the one who's complaining and making this person making feel bad. So maybe there is no problem at all, or there is a problem is less, not that severe, but the partner is making it or creating
No,
heat
ma'am.
out of it.
Yeah,
There is
that's
one more
actually
thing.
can be asked. Yeah, yeah, Dr. Suman,
Yeah,
please.
that if the patient is saying that he hadn't had intercourse with his wife or partner for long, then there is no use to ask that there is penetration or something like that. I think
Yeah,
so.
that
If
was my point, ma'am, because he is
patient
not
already
having
told that.
Yes, one by
Yes,
one,
yes.
please, Dr.
Yeah,
Abhishek.
Dr. Abhishek.
Dr.
Dr. Abhishek.
No,
complete,
Dr.
please.
Suman,
Dr.
you
Abhishek,
first,
Dr.
then
Abhishek,
answer.
please,
Then I
please.
have told everything
You are
regarding this.
saying the
You
same
just
point.
continue.
You can continue, please.
No, like,
That's all
yeah,
right.
that was my
Yes, I
main thing.
understand.
And
I understand what Dr. Abhishek is saying. That he
ma'am,
should
in
have
actual
modified
exam, what has
his
yeah,
answers
what
according
has
to the
happened, ma'am, in
responses.
previous exam, what has happened, like it was mostly due to psychological cause, and the patient would get like nocturnal or morning erection, but whenever he tried to have something intercourse, the patient would not get erected, something like that. So in that regard, the question are arranged in that way, ma'am. But here, Dr. Siddharth, whatever Dr. Siddharth said, like anything can happen in the exam scenario. They can modify it, they can do whatever it is. Yes, ma'am. So at first, we just have to get to the flow that what is the patient is complaining about. Then we can ask the relevant question, like we have in our hand, like this question I can ask. Or before asking, like in these 3 months, have we ever tried any sexual intercourse, something like that? If the patient answer like I have tried, there or something like that, then we can go with the flow also. Like was it for like it was good for both the partners or something, like did both the partner had any sexual
that was
satisfaction?
good.
Yeah.
Yes.
Yeah,
I
so
do agree with
this
that.
question notes are in that way, ma'am, but like sometimes the
I
notes get like
understood. I
whenever
understood.
yeah
Considering the
yeah.
responses that he was getting, he could have
Yes,
modified.
ma'am.
This is what you're trying to say.
Yeah.
Yes.
Yeah. Otherwise, everything Dr. Mohammed Alan actually asked regarding all the relevant questions and everything. He asked about any previous disease and about this scenario. The main three differentials, I think it should be like the atherosclerotic vascular disease due to smoking, and regarding the antihypertensive, it can be drug induced or it can be psychological. Yes, ma'am. And about the prostaglandin E1 injection, that's not used in treatment purpose. That actually used if there is any curvature. So we just inject it in the corpora cavernosa and just wait for 10 minutes to do any type of penile ultrasound or see if there is any curvature or not, if there is any dysfunction or not. So for diagnostic purpose, actually, ma'am.
Yeah.
Yeah, ma'am.
I agree.
Good.
That's from my side.
Yes, please.
I have a point here. How we can ask for chaperone if the subject already embarrassing? If the patient he come and embarrassing to speak, and we are asking for a chaperone additional.
Yes, because it's a very personal questions you have to ask, and presence of a third person is very important, because it's very embarrassing for patient to confess or open up. And if the candidate is asking question in a way to make patient feel down or to degrade it, like in a degrading sense, so the chaperone would be there so that both will be in the respectable platform or respectable environment. That's why presence of chaperone is important.
And just one thing, ma'am, if the patient disagrees, like he doesn't want any chaperone, you will not ask for it. You'll just say to the examiner, I'll do it. Yeah, definitely.
Yes. If patient refuses that, no, that's all right, I don't need a chaperone, then it's a totally different thing. But if patient is quiet, then examiner has to intervene and say, okay, I'm the chaperone, or should provide one. But asking is very important. This is one station in which you have to ask. All right, good. Anyone else want to add anything? All right, if not, then we can move on. Thank you. Here is the timer, and here is your question. Right. If you have read and understood, kindly begin your history taking session.
I did not understand. To
So,
perform a psychosocial examination.
yes, a patient has low mood. So you understand what is low mood. I don't want to tell you the diagnosis.
Okay.
Follow the last word. Follow the last word. Like
Okay.
take.
Okay. No, because I'm seeing confusion. Okay.
No
Sorry,
worries.
yes. No, it's not confusion. It's patient has
Okay. Can
fourth
start.
visit and low mood. Yes.
Okay. Yeah.
Yes,
You
please
can start
begin.
timer.
Yes. Okay.
Yeah. Hello. Dr. Sunday. One of the surgical doctor. Can I just confirm your name and age, please?
Oh, you are a doctor. I am. I think my name is Robert, and my age. Okay, 67. I guess, doctor. 67. Yeah.
Okay. Nice to meet you, Mr. Robert. Today I'm supposed to ask you a couple of questions.
Yeah.
Network gone.
Oh.
Dr. Sunday.
Sorry, ma'am. Please stop the timer, I guess.
Has he disappeared? Disconnected?
No, he's not disappeared till now,
Dr.
but I
Sunday.
can't hear him either.
He will be disconnecting because yeah, the network is really bad. Someone joined. Maybe he rejoined. I've stopped the timer, but
sure.
Hello.
Yes,
Sorry,
yes.
please.
Continue.
My phone off, so I have to join with. Okay. Yeah. Hello, Mr. Robert. So, can you please tell me why you are in the hospital today?
Doctor, I took some medication. Like I don't remember, and I'm feeling. I don't know what I am feeling about. I'm really my husband actually. Sorry, my wife actually have taken me here. I don't know, doctor.
Okay. That's fine. That's fine. So, let me just ask you a couple of questions. So, uh, earlier you said you are 65 or 67 years old, right? So, can you tell me?
Yeah, I've told you.
So, when was your date of birth?
Sorry.
Hello. Yeah, you want to say something?
Yeah.
Continue.
No. I didn't get you, Doctor Sunday. Please.
Okay. So I said,
Can you please repeat?
yeah. Earlier you said you were 67 years old, right? So can you tell me
Yeah.
exactly when date of birth?
Exactly what?
Your
I
date of
couldn't.
birth.
Oh, okay. I've told you my age, doctor. I really don't remember what was my date of birth. You can ask my wife if you want, and I don't feel like talking to anyone right now.
I'm so sorry to hear that. So, if you cannot continue, well, maybe we can do this later if you don't mind.
No. Please complete this. I just want to get rid of this.
Okay, that's fine. So,
After that,
can you just tell me? Do you know what today's date is?
it's 19th. Sorry, it's 20th April maybe.
That's fine. That's fine. So, I will tell you an address now. I will ask you at the end. Hope that's fine. So, 24 West Street. Can you repeat that for me, please?
Okay. I'll try, doctor. I'll try for you.
Yeah, just repeat it for me first.
Yeah.
Anyway, okay, that's fine. That's fine. So, I would like to ask you, do you know who is the current monarch for the UK?
No, doctor. I'm actually not from UK. I really don't know. I guess.
That's fine. So earlier on, I introduced myself as someone. Can you tell me who am I and my role?
You told me. You told me, right? You are the nurse here. Oh no, what have you told? I don't remember
Okay, that's
much.
fine. That's fine. That's fine. That's fine. That's probably fine.
Okay.
So I would like to know, do you know the year that the World War II ended?
It's 2001, I guess.
Okay.
Oh, I'm sorry.
No.
I'm really
That's
messing
fine.
my
That's
head
fine.
up.
You are doing excellently well. Don't worry. You are doing fine. So
Yeah.
so the next question is can you just count from 20 backward for me?
Okay, you are just playing this counting game. Okay, it's like 20, 19, 18, 17, 16, 15, 14. Okay,
Okay,
because
that's fine. That's fine. That's
10,
fine.
9. Yeah, yeah.
Yeah, that's fine. So can you tell me the address I told you earlier?
It's 22 Baker Street. You have told me, right?
Okay, that's fine. So can you tell me do you know where you are right now?
Okay, yeah, I think I'm in a hospital right now. My wife actually brought me here.
Okay. So yeah, Mr. I can tell you your memory is very perfect and is better than mine. So I would like to ask you a couple of questions if you don't mind. Uh, so I understand that you've been to hospital quite a number of time. So can you just tell me what's really like? I mean, can you remember why you've been in, like the reason why you came to hospital today and previous time?
Yeah, it was kind of like I was something. I also took some medication. Like like this time, I can what I can remember.
Okay. So do you have any past medical illness that you've seen your GP for or that you've been treated for?
Yeah, doctor. What I can remember, I have blood pressure, diabetes, and something like increased cholesterol, as far I can remember. Yeah.
That, yeah, that's fine. That's fine. So do
Okay.
you know whether you have uh, is there any family background, of maybe of any of the disease that is of any
Uh,
concern?
I really don't remember, doctor, right
Okay,
now.
okay, that's fine.
It's
You know
really
what?
hard for me.
Yeah, that's fine. I completely understand. So maybe I guess I will have to speak to your wife and get other information from her. Thank you very much for your time.
Yeah, doctor. Thank you so much for making it so much short.
Yeah. So I will get back to you and I will go and speak to your wife. So I would like to summarize my case.
Yes, please.
But do I still have time? Because I don't know. I didn't hear anybody. Okay, so today I took a history of a 67-year-old gentleman. So and that came to the hospital after taking overdose of drug. And while I was talking to the patient, I noticed that the patient is confused and he
Yes.
couldn't even remember the reason why he was in the hospital, and he couldn't even remember his age. So I
Yes.
decided to do abbreviated mental test on score. So
Yes.
for which is scored 3/10. So
Yes.
which shows that he's probably having a very severe confusion. So and I would like to complete my history by performing mini mental tests to
Yes.
really grade the severity of his confusion, and also I would also like to further investigate the cause of the confusion.
So what are your differential diagnosis for this patient?
So my differential diagnosis will be confusion, so which can be from several causes, but I would like to consider acute urinary infection, urosepsis, considering his age.
Yes.
Then that can also be caused by maybe dehydration, electrolyte disbalance, or maybe cerebrovascular disease, or even a TIA,
Yes.
and even any form of a brain tumor.
Yes. So how do you plan to manage this patient?
So to manage this patient, first I would like to perform proper physical examination, especially cranial nerve examination. Then and also after that, I would like to arrange a consult with a neurologist or neurologist, and also a social care services. So then I would like to, of course, also refer the patient for cognitive behavioral therapy. If there's an indication for that, then I will do blood work to exclude other causes that I was trying to exclude, like cancer, infection. So full blood count to exclude infection. Then also tumor markers. Then I also like to perform a CT head and a MRI for head to rule out any form of cancer or cerebrovascular disease. Then after that, if after getting the cause of the confusion, then we can treat the cause. If it's not generic, then I can refer the patient to neurologists or neurosurgeons.
Good. Okay. How would you rule out if the patient's condition is mild or moderate to severe?
So according to first 8 MS test that I did, so less than 8 to 7 is a mild. So
Yes.
then less than 6 to 7 is a moderate, and less than 6 is more severe. Then according to millimeter test, so that's a more than 24 is normal. No, more than 27 is normal. 27 to like 24 is mild. Then less than 24 to like 14 is
So when would you
moderate. And
consider admission of the patient in psychiatric ward?
so of course, if it's severe, so we're going to admit the patient in the psychiatric ward.
Would you or would you not consider use of
Yes,
mental
I
health
would.
act?
I would.
Mental health act,
Yes, I would.
if necessary. Yes, very good. Okay, Dr. Abhishek, can you please give feedback first?
No, ma'am. It was perfectly all right from Dr. Sandy's side. And what I have heard actually, like people may get mild dementia or delirium, something like that. And also like people can be very much less responsive. Like here I was like less responsive because of this confusion, something like that. I was kind of like agitated, and the patient can be more in some scenario also. And Dr. Sunday, actually, in this regard, actually, in this station here, your first provisional is in the stem, right? So first of all, if you can just utter this one, like due to medication, the patient is confused. And after that, you can switch to the infection and all the things. First of all, infection, electrolyte imbalance due to hypoglycemia. And after that, you can do the systemic one, like endocrine, neurological, and all the things. Other than that, and last of all, just don't forget about the senile dementia, because that's required in other station, preoperative confusion, right? So that was really good from your side. You are very much comforting, and I was just laughing in some like your memories better than mine. You are just saying that was pretty much good from your side, definitely. And other than it's really good. Thank you.
Yes, Dr. Suman Kumar has raised a question that he thought it was a depression station. And
Yeah, I thought
also,
also.
yes,
Yeah,
it was a depression station.
Yeah, but I have to follow the patient, what he gave to me. So
yeah,
I thought that's.
But then, yeah, that's why I thought.
Patient cannot give a history, no, ma'am.
Yes, but they will make you take the history.
Yeah, for your confused
patient
patient,
is confused. Yes.
I understand that it's kind of confused. So I have to just do ATMS test,
Yes.
and I couldn't order history because it's confused.
Yes.
So and you have to
it
talk
was
to the
little bit confused, ma'am, because the patient was confused earlier, and then you were just in the last line it was like saying low mood. Then I just
now
choose
I
one.
wrote low mood because I had written psychosocial examination because I wanted you to do the mini mental test for ATS. So I thought Dr. Sunday was saying he's getting confused with my question. So I wrote okay, low mood, so he would know that it's low mood. Before that it was confusion written here. But then, yes, it was low. It was depression.
Yeah, it looks like that.
No, I have a
So
question. We
he
do
could have
the
asked question about sleep cycle, mood, appetite,
Yeah,
libido,
I could have
fast.
asked. I
Yes.
wanted to ask, but the patient is clearly confused. So I realized I couldn't get any concrete information from the patient except
Yeah.
talking to the wife. That's why
Yeah.
I said I have to talk to your wife to get further
I was
information.
just confused. Yeah.
Yeah.
Yeah. Good.
I mean, the ANTS, if we get that the patient is scoring less than 6, then we go to MMSC? Is it like that? Or
Yeah.
Yeah, I think for AMTS is less than 8. Please, everyone.
no, this was less than 5. I was counting actually, but
He actually mentioned it 3 out of 10. So
See,
didn't
because
you say
no,
3
I'm talking about generally. In the
Okay.
note, it's written less than 6, but
or
yeah, in the
2?
note is
Yes.
written less than 3.
yeah,
Three
GPA
means
is
severe
less than 8.
dementia.
So
Yeah,
less than 8 means there's confusion. So to be normal must be 8 and above.
Yeah.
Yes. Yeah.
So please, yeah.
Yes. Good. Okay. Right. Thank you, both of you. Now timer is here, and here is your question. Right. If you have read and understood, kindly begin your history taking station.
Okay. Hello, I'm Hana Idris, one of the exam candidate. Can I confirm your name and age, please?
Hi, Dr. Hannah. I'm David, 28 years old.
Nice to meet you, Mr. David. Today I have asked to ask you a few questions regarding to your condition. Is that okay with you?
That's all right.
Okay, thank you. How I can help you today?
So, Dr. Hannah, I've been having this left knee pain for the past 3 months now. It's really been disturbing me.
I'm so sorry for hearing that.
Right.
Do you want a painkiller right now?
That's all right. It's okay.
Okay. Okay, can you please um, describe this pain when you first noted?
So, the pain started like 3 months now. It's been really paining, like a lot, but I can stand the pain. It's been paining.
Okay, can you describe it as cramping or stabbing or dullness or
Yeah,
it
it's
is a
just dull
nature?
pain. Yes.
Okay, the pain go anywhere to your back or
No,
lower?
no, it doesn't go. It doesn't go anywhere. My knee.
Okay, this is anything make this pain worse?
Really, only I noticed it when I'm walking around. It pains is really hot. I can't even
Okay,
do my normal activity.
okay. There is anything make this pain less?
Really, when I'm resting, it's okay. It's much better. Still there.
Okay, this pain it's increased in a specific time at the day or not?
No, no timing.
Okay. If there is rating from 1 to 10 and 10 this is the worst, can you please
5.
rating your pen? Okay, sorry for that.
Mm.
Is this pain affect your day-to-day activity?
Yeah, just when I'm walking, it really disturbs me, but I still go around. But it does pain.
Okay. When you're walking, do you experience your leg giving away?
Yeah, a bit. It goes away on the
Okay.
just a bit.
Okay. Do you experience looking in the knee? Knee.
No, my knee, no, it does not. But not really.
Okay. Do you notice any change in the shape of your knee?
Just a might swollen a bit. That's all. It swells a bit sometimes.
Again, please, I can't hear you.
It swells a bit, swelling.
Okay, swelling. What about any redness or?
No redness.
Okay. Okay. Any numbness or any weakness in your limbs?
No numbness, no weakness.
Okay. At the morning, when you wake up, there is any stiffness?
No stiffness.
Okay. Do you have any redness or painful in your eyes?
No.
Any skin rashes or any diarrhea, anything?
No.
Any back pain?
No, I don't have any. It's just my knee.
Okay. Do you have any trauma before or surgery
Yes.
in your knee?
Yes.
When?
About a few years ago, about like 5 years ago, I had trauma, and then I was operated.
Okay, I'm sorry for that. Okay, do you have any? Do you visiting the GB for any chronic disease like diabetes, hypertension, or anything?
No, I'm
Okay.
healthy.
Okay. Have any surgery other than your knee surgery?
No, only this surgery.
Okay. What about your drugs? You take any drugs?
Apart from painkiller for this pain.
Okay. Painkiller. Okay. What about any allergy to any drugs?
No, I'm not allergic.
Anyone of the family have the same problem?
No, I'm the only.
Okay, if you don't mind, I will ask you a personal question. Do you working?
Yes, I said. Actually, I'm a footballer, but I've not been
Okay.
performing all this while since I had. Then now I
I'm
have
sorry.
any pain, so I've not been doing much.
Okay, I'm sorry for that. Do you smoke?
No, I don't smoke.
Do you drink alcohol?
No, I don't.
Do you have any difficulty with steering right now?
With the?
With the stairs?
No, I don't. It just
Okay.
hurts when I'm climbing the stairs.
Okay. What do you think the cause of your pain?
And I don't know, but I think it's related to my the knee injury that I had before. That's what I think, but I don't. But I want to know.
Okay, what is your most concern about?
I'm a footballer, so I want this to go away.
Okay, what
I can go back.
okay, we will try our best to helping you to
Thank
that.
you. Thank you,
I want to thank you. I want to summarize
Yes.
my
Can
history.
you present your case now? Yes, please.
Okay, today I had to take a history from David, 28 years old footballer. He had a surgery at the knee and trauma before a few years, and now he coming with left knee pain for 3 months. The pain it is dullness, and it is about 5 in rating, and it is increasing by walking and decrease by rest. And Also, patient have swelling in the knee and the knee giving away when he walking, and otherwise it is he is well. My first differential diagnosis, it is cruciate ligament injury or osteoarthritis post-trauma.
Yes.
And it may be meniscal injury or rheumatoid arthritis or referred pain from any from the back.
Yes. Okay. How do you plan to manage this patient?
After full history and examination, I will go for some blood test for ESR, CRB, and rheumatoid factor and routine investigation, and I will go for X-ray, anterior, posterior, and lateral weight bearing X-ray for check the any deformity. And after that, I will start conservative treatment,
Yes.
painkiller and painkiller and rest, and encourage the patient to do regular exercise. If the patient weight is above the normal, ask him to he should decrease his weight, and also I will prepare for refer the patient for physiotherapist, and if the patient need intra-articular steroid after that. If not improving, I will go for surgery for arthroscope and arthrocentesis to decrease the swelling and relieving the pain. And if need total or partial knee replacement after that.
Good. Do you think patient will be able to play football in 9 months' time?
I think no. Till he full recovery.
Yes. Good. Thank you. Yes. Dr. Fatimata, would you want to give feedback first? Is she here? Yes.
Is it me?
Anyone else? Yes, please. Would you want to give feedback first?
Okay, she actually did well. She's new.
Yes.
But I think on top of her list, with the history of trauma, the operation, and all that,
Yes.
first differential should be osteoarthritis.
Yes.
Yeah, but I think she did well. She just didn't know that when the bell goes, you should stop and then just say what you have not said and then give your and continue. I think she did well. She covered everything. Yeah. It's good.
Good. Okay. Yes. Anyone else want to give feedback? I was reading the messages. Sorry. Yes.
No,
Yes.
ma'am, it was really good. And what Dr. Fatimata actually said, the first differential may be the osteoarthritis. Then we can go for the rest. That's it.
Yeah.
And yeah, that's it, ma'am, from my side.
Considering a patient had one episode of injury before, few years back. So
Yes.
yes. Good.
Thank you, Mama.
Thank
you,
you.
Fatimata.
Yes. Good. Thank you. She's shy, but yeah, I'm happy that she's bringing the courage to come and participate. So